Rural Health Transformation Program Explained, funding for 2025 and beyond. Before we get started, I've got a few housekeeping items for you. First and foremost, know that you may listen hands-free over your computer speakers or headphones. There is no need to dial in. If your audio does become disconnected, though, you can use the audio and video menu at the top of your screen to access the feed. This event is being presented in English, however, there is captioning available. You may ask questions at any time during today's event using the question and answer interface on the right-hand side of your screen. Feel free to submit as many questions as you'd like. We'll get to as many as possible towards the end of the hour. If we run out of time and don't have a chance to get your question, you can email us directly. Now, if you don't see the Q&A box automatically in the bottom right portion of your screen, look for the three little dots or ellipsis at the bottom of your screen and find more interface options. From there, you can select and have the Q&A and other features pop up. Finally, note that this session is being recorded. The recording will be available for download at the Grants Office website starting tomorrow. Our fabulous media coordinator, Kate, will drop that URL in the chat box for you now. The PowerPoint slides presented here today will also be available at the same location, or you can send us a quick email request to education@grantsoffice.com. Kate will also put that email in the chat now. Again, today we'll be talking about the Rural Health Transformation Program, and with that, let's get on with the show. We are joined today by our resident expert on healthcare funding, the amazing Amber Walker, a grants development associate here at Grants Office. Amber came to Grants Office after working on grants at a large health system and has assisted numerous healthcare organizations with securing grant funding during her tenure here at Grants Office. We're thrilled to have her on board today to discuss this very important grant program and tap into her expertise on this new funding stream. Again, if you have any questions throughout the event, please send those over to us using the question and answer interface on your screen. Don't be shy with those questions. We have budgeted plenty of time to answer your questions at the end of the presentation. We've got a jam-packed session for you today that is going to cover a lot of wonderful information. This is the largest net new funding stream contained in the One Big Beautiful Bill Act, investing $50 billion in rural healthcare over the next half decade. We'll start out with the critical details regarding the RHT program, which is currently open for state agencies that will be administering the program. Amber will go through the distribution mechanisms that will ultimately result in the funds making their way to rural healthcare providers. She will conclude with some commentary on what to expect to happen next as the five-year timeline of the program unfolds. I'll briefly discuss some Grants Office products and services that can help you maximize not only this funding opportunity, but assist you wherever you are in your grant-seeking journey. Now, enough for me. I'd like to introduce you now to Amber to discuss the Rural Health Transformation Program.
Thank you, Chris. Amber here. Good afternoon, everybody. Thank you for joining us today to talk about the Rural Health Transformation Program. And I'll go ahead and get started right now. The Center for Medicaid and Medicare program was announced over the summer and essentially designed to help rural communities transform their healthcare delivery. Now we know there's $50 billion total anticipated dollars going to this program that will be broken up over 5 years at $10 billion annually. At this stage, the only eligible applicants are state governments or their designated agencies. DC and US territories, unfortunately, are not eligible, and local rural providers and healthcare facilities are not eligible to apply for this funding opportunity. We expect them to come into play later on in the process, but for this November 5th deadline, that is for 50 state governments only. Let's go a little bit more detailed into the timeline of events since this is a brand new program. Over the summer, the One Big Beautiful Bill Act was passed and this program was announced. There were a couple of things relating to rural health providers that were announced in that bill. One being a historically large cut to Medicaid and Medicare, and simultaneously a historically large funding opportunity for rural health. And at the time that it was announced, it really, from my perspective, created a lot more questions than provided answers for. But it did give some general program guidance, and it gave a chance for states to start thinking about this opportunity. September 15th rolled around, the notice of funding came out, and it went into really great detail on what states would need to do, how they would need to compile their plans, gave the application due date, which was a big question mark because we knew that through the guidance in the One Big Beautiful Bill that the funding allocations would be made by the end of the year. So the anticipation was that turnaround was going to be rather quick for the application window. And it was very kind of them to provide us with that date because that gives the local providers, health systems in those rural communities, at least an idea of when to start looking for funds to roll out within their states. So we're anticipating that no sooner than January, programs will begin to get underway. But then shortly after the new year starts, that we start to see programs starting to go through. So right now that leaves us in the middle of the application window. And by this point, most states have opened up a process for collecting information from stakeholders. The exact process really is varied quite a bit state to state. Some states are taking a close to the chest approach and only consulting with a select team of high level stakeholders and experts. And some states are asking every provider, every patient, every person in their state what they should do with the funds. The majority of surveys and requests for information windows have closed at this time, and states are beginning to develop their proposals based on that feedback. But they've also been very forthcoming with information. So states are not only collecting information, they're also keeping their stakeholders informed of the process and how they're choosing their priorities. And some states have even begun to outline their chosen focus areas already. And so that has been really reassuring, as the more information that states provide about the process, I think the better reflected and the better represented the rural communities are actually going to be. So as states have collected this feedback from their stakeholders, then they're beginning to develop their plans and their proposals. They need to keep in mind the 5 strategic goals that were outlined in the guidance. And these are somewhat, subjective, but I can provide a little more context on what Make Rural America Healthy Again means. They were able to provide that it's really looking at evidence-based and outcome-driven interventions. And there's a lot of focus on disease prevention as well as chronic disease management. Sustainable access is a little more straightforward. They're really looking at how they can support rural providers to become long-term access. So improving efficiency and sustainability is a major focus with that goal. Workforce development, of course, recruiting and retaining healthcare providers in those rural communities. Innovative care is really looking at alternative payment models, right sizing healthcare delivery, and different ways that we can reduce the cost of care. And tech innovation is wide open, and goes on to say it's really going to projects that are supporting access to remote care, which is a theme throughout, improving data sharing, strengthening cybersecurity, which really I think sticks out to a lot of healthcare providers because that is an ever-growing need, and funding in the healthcare space for cybersecurity specifically doesn't even match a portion of the need for that. So in addition to cybersecurity, investing in emerging technologies is another focus of that strategy. So pretty open-ended, but something for the states to keep in mind as they're building out their plans. In addition to the 5 strategic goals, states are also going to have to identify 3 different eligible expenses that they're going to base their proposals on. A state must identify at least 3. Of course, there can be more. But they are essentially meant to kind of drive home the fact that this funding is not meant to supplement ongoing operating costs. It's really meant to provide sustainable investment in healthcare delivery. You can see that in the provider payments, where that is capped at 15%. But you can also see that in innovative care and workforce, IT advances, and things like that, that the states are really intending to transform healthcare. So once the states have identified their permissible uses of funds, they're looking at making sure that they are not going against the restricted uses of funds. And I'm not going to go into too deep of detail on the restricted funds, because I think that could be a whole webinar in itself, matched with the formula for the funding allocations. But the big takeaways here is that not only are the eligible uses of funds meant to drive home the fact that this is not meant to pay for operating costs or offset cuts to Medicaid and Medicare, but also that these fundings are meant to really limit how much is going to waste. So there's certainly exceptions to no new construction. They are allowing renovations and things like that. But in addition to not offsetting costs that are lost, there's also another focus on that any of the restrictions that are placed at the federal level are also going to be put on any local applications as well. So if a state opens up a competitive grant, those funds will be subject to the restrictions that the state is subject to from the federal level, and then any additional restrictions that the state puts in place. So once the plans are developed and submitted, then we're looking at scoring and distribution of funds, which is quite complex. As I mentioned a second ago, that literally could be its own webinar in itself. It's very complex and there's a lot of formula that goes into it. So I'm going to, for the purpose of this webinar, give a mid-level explanation on what that looks like. Essentially, there is that $10 billion annually, $50 billion total, which is split in half at the start. There's baseline funding and then there's workload funding. Baseline funding will be split equally amongst approved applications. So if all 50 states are approved, that's $5 billion annually. They'll get $100 million each. That will be equal amongst all approved applications. The workload funding is going to be distributed unequally. It will be given to no less than 1/4 of approved applications, and that will be based on a variety of factors. So it's quite possible that some states will receive no workload funding, but all approved applications will receive that baseline. Now I'll go a little bit more in depth about the factors that go into the workload funding and how those awards are determined, but you can really think about the state's total award is these two combined to make one award. So it'll come out at the same time, and it's essentially from the same funds, but it's kind of broken up in this way. When we're looking at the workload funding factors, there is a number of things that go into it. So the rural data is going to be scored once based on quantifiable factors like rural population, or total square miles of the state or number of facilities in a rural area. And as I mentioned, that will be scored just one time for that initial application and then will not be reevaluated again. The initiative-based score will increase as states meet application milestones that they identified in their plans. So that's going to be things that are a little more subjective, like data infrastructure or remote care services, and it will be reevaluated each budget period, and states will receive higher scores as they complete their milestones and as they have that real world impact. State action policy is the third factor that goes into the workload funding award amounts. And that is also another factor that's reevaluated each budget period. To give an example of what that looks like, the SNAP waiver that was talked about a lot over the summer that essentially restricts what SNAP benefits can be used to pay for, like non-nutritional food. And a state will receive points based on their state policy. So it'll be between 0 and 100. A state who has no waiver and no plans for a waiver would receive 0. And a state that has already implemented it would receive 100 points. And then there's a scale in between. So depending on where in the legislative process your state policy is, would determine how many points you would receive. And so you can see how when that is reevaluated in the following year, if your process has moved along in the legislative process and become implemented, a state would receive more points for that. So now that we know kind of how much there is and what goes into making an award, what is next and what are some things that we can look forward to? So as we know, each state is going to be unique. They've all outlined their own priorities. They have all been allotted a different award amount. We're already seeing transparency between states be varied. Some states have been doing an excellent job, and I would even say the majority of states have been really forthcoming with information. And some states are definitely playing a little closer to the chest, which is somewhat understandable, as I'm sure they don't want to paint themselves into a corner. But obviously, the more information that is provided to stakeholders, I think, is certainly appreciated. And the distribution plans is going to vary quite a bit from state to state. On the national trends, we're starting to see some states hinting at open grant competitions, which I think is really helpful in planning and for the possibilities from 26 moving on when those funds start to come out. But each state is going to be quite varied. So it'll be important to kind of keep up to date on what your state is doing. When we're looking at what looks like post New Year, so January 1st going forward, we know that some states are most likely going to have open grant competitions. Some states are going to have non-competitive subawards. And we know that states have to spend these funds by the end of the subsequent fiscal year. So the expectation is plans and projects and grant competitions kind of get moving pretty quickly after states receive these funds because they don't want to pay back any of the award amount, of course, with the amount of need that is in the rural communities. Every dollar from these awards is going to count. So the expectation is plans are going to be rolling out pretty quickly. And there's no specific restrictions on if a state must open an award or not open award. However, they have to provide a rationale in their plan. if they intend to do funding allocations through a grant competition or subaward. So they need to provide the methodology and the processes and specific criteria that they're going to use for the selection of who receives these funds. And again, conditions of the federal funds are going to flow down to any subawarded funds as well. And what you can do now. So I want to first start off by saying that there are no specific restrictions in the NOFO on what provider organizations can effectuate impact on rural communities. So there is a place for every healthcare system, provider, and entity in the state to be paying attention to how this funding is shaping up, and also potentially participate in receiving some funding as well. I'll use a pretty basic example of telehealth. You can imagine a hub and spoke model where an urban health center is providing that specialty service out into rural areas. And so there's certainly potential for urban hospitals to participate in this funding as well, as long as the end recipient and the end beneficiary of the funds are those rural communities. So that's going to include all kinds of hospitals, federally qualified health centers, behavioral health, mental health, opioid use. The list goes on the types of providers that can be wrapped up into these programs. And secondly, review the webinars that are made available. By this point in time, most states have designated their lead agency. It's kind of overwhelmingly the departments of health. There are a couple state exceptions out there, but most states are going with Department of Health. So that would be my first recommendation to look at. And most states are creating listservs and posting their webinars, holding town halls, and creating pages on their state government websites to keep track of this information. So I definitely encourage you all to keep a really close eye on what your state is doing and how much information they are providing for their constituents. As far as I know, a couple states do still have their requests for information open, including Arkansas, Hawaii, North Carolina, Ohio, Vermont, and Wyoming. So if we have any attendees from any of those states, definitely check out your websites. And if you haven't had a chance, provide your feedback. That opportunity is open. If you're not from one of those states, double check because some states have opened back up their surveys or left them open longer than they had initially intended. So there's always a possibility there as well. So all that to say is stay engaged. There's room for everybody within this program who is delivering healthcare. And before we break for questions, I'm going to pass the mic back to Chris LaPage, our Chief Services Officer, and he's going to talk a little bit about how you and your organization can stay engaged with Grants Office and some of the resources that we have available. So back to you, Chris.
Oh, thank you so much for that great information, Amber. Really appreciate it. And one of the questions we actually had come in was how can we stay updated on when the funding opens to providers that are not under the state? And you obviously did a great job here of talking about staying engaged, signing up for state listservs and other information. But I think that does dovetail quite nicely into our discussion here around Grants Office Communities. Is an exciting new platform we recently launched. It's a comprehensive grant search and collaboration platform. Several types of subscriptions are available through this. Individual users, if you're looking for a group-based license for small teams up to 5 folks, which could be a department or folks who serve in a function in an organization, or you're looking for access across your entire organization. Encourage anyone interested to scan the QR code or go to communities.grantsoffice.com to learn more about the platform. We had a launch party on September 10th, and that recording is still available on our website for anyone that's interested to view that. In that sense, in terms of the platform, I just wanted to note the key benefits. So Communities puts our extensive database of funding opportunities, federal, state, foundation grants at your fingertips. You can use our advanced filters and search functionality to find and even share funding opportunities with your colleagues. The platform allows you to seamlessly manage all your projects and grant proposals in one place to set you up for success. And the best part is you can invite as many collaborators as needed within or external to your organization to view and work on your projects, grants, and proposals. And finally, you can hit the easy button if you need help, tapping into the experts here at Grants Office to support you along the way. And this is an example right here of the RHT program that's within the platform. As you can see, it gives you all the critical information you need, program details, award information, eligibility, allowable use of funds, links to application materials, key deadlines, and so much more. So you have all that in the platform, but even more than that, I wanted to also show you this screenshot of the search functionality, which includes a keyword search along with filters for specific types of project categories, grant eligibilities, geographic focus, funder type, etc. You can use the platform to track the RHT program. You see the yellow star there indicating that it's been added to your favorites. And this is critically important for RHT program and really gets to the question that was asked, because there's going to be 50 different states administering the program, and they may develop several programs under the RHT umbrella. You will be able to track all these state pass-through grant opportunities within the platform. More than that, as you can see, you can find a lot of other funding opportunities to support your important healthcare projects, which are going to be crucial for rural healthcare providers. Because while this opportunity is providing $50 billion over the next 5 years, the Medicaid cuts that were included in that bill are expected to hit rural healthcare providers to the tune of $150 billion or so estimated over the next decade. So to Amber's point about using these funds to set yourself up for success and to withstand those cuts, you also should be looking for all sorts of external funding you can find in terms of the grants landscape to support your critically important projects. And more than that, again, you can add these grants to projects, which is critical. So you can align specific grants to specific projects that can support your organization, and then you can have all the grants, projects, and project grant proposals all in one place for the collaborators to work on it. As I mentioned, while Communities provides you all the tools you need on your self-directed grant-seeking journey, Grants Office is available to provide a more hands-on approach to support your grant-seeking journey as well. We're a full-service provider of grants intelligence, consulting, proposal development. So if you're ever feeling out of your element or overwhelmed or you need any type of support, we're here and happy to help, whether it's prospecting research, whether it's proposal review, full grant writing. We even have annual support programs that cover you for the full year for all your grant seeking needs. So if you ever want to engage with Grants Office, you can get started by filling out the Contact Us form on our website. From there, we'll set up a meeting to discuss your goal and determine next steps. That could include a detailed funding opportunity report, one-on-one with our experts, draft application review, full narrative grant writing, or even comprehensive annual support. Whatever you need, we'll work with you to right size our assistance. And with that, let's see what other questions we have. I know we're just about at time here, but I think we do have another question or two in the queue we might be able to do. How will the government shutdown affect the RHT program? Amber, could you address that?
Yeah, absolutely. That's a great question because I know that is top of mind for a lot of folks right now. What we do know is that the Center for Medicaid and Medicare has indicated there will be no adjustment to the application deadline of November 5th. So expect that to remain the same, as well as the help desk for the Rural Health Transformation Program run by CMS is still operating. They are expecting delays in reply. So if you have a question, don't wait because there may be a delay, but they are still checking and they are still operating it moving forward. I hope that helps.
Yeah, thank you so much, Amber. And that is all the questions we have time for today. If your question didn't get answered, or if you think of one later, please email us at education@grantsoffice.com. Again, that is in the chat for anyone looking for that address, and someone will be in contact shortly. Again, thank you to Amber for sharing your expertise with everyone in attendance today and watching this recording sometime in the future. And speaking of recording, remember today's session has been recorded, and that along with the slides will be available on the events resource page within the next 24 hours. So if you missed anything, want to share this event with a colleague or acquaintance, or even want to come back later for a refresher on something we covered today, you can always go back and review today's content at your convenience. We hope you found today's event to be valuable use of your time, and we look forward to seeing you on future Grantcasts. Have a great rest of your day, and thank you for joining us.